Good evening, my wonderful people, my Facebook family. You are all welcome to my live channel where we are going to discuss on a very important topic titled Causes and Management of Hormonal Imbalance. I want everyone now to listen to this teaching. If you are a woman battling with hormonal imbalances, you've been going to hospital, they have been telling you to run one test or the other. You've tried every means to see if you can tackle this problem, but no way. You don't know what is hormonal imbalance in the first place. Now I want you to pay attention. Please share this my talk. Share my page, Kina Health TV. This channel, this TV, this my page is very, very important. As long as your health is concerned, as long as you want to understand everything that is happening in your system, as long as you need health, I want you to take this my page very, very serious. Share this page. It's a health channel page that will benefit you and people around you. Please share it. Hit the share button and share it. It's not only for your feed, it's not only for your benefit, because this is a new Facebook I just created for my teaching. I want to be using it just for my health teaching. So just share it to people, let them join, because whenever they join, whenever I release any of my posts, they will go through it and it will save a lot of souls. It will help a lot of people. Now let's continue. What is hormonal imbalance? Are you with your paper? Because whenever I'm teaching, I will tell you to bring your paper and pen. Bring your paper and pen whenever I am teaching. So bring your paper and pen, because you are going to learn one or two things from me. What is hormonal imbalance? Are you ready? Let's go. What is hormonal imbalance? Let's go. What is hormonal imbalance? Let's start. I hope you are seeing me. Yes, you should see me clearly. Hormonal imbalance occurs when there is too much or too little of a hormone in the body. When there is too little or too much hormone in the body, it will now result in hormonal imbalance. A lot of women are passing through hormonal imbalance. A lot. They have gone to hospitals. They are finding it difficult to conceive. Their menses have stopped because of hormonal imbalance. They don't know what is hormonal imbalance. All they know, they have run tests. They told them they have hormonal imbalance. We don't know what is hormonal imbalance. So, sorry, I'm sweating. Yes, I'm sweating because I went out, so I don't want to miss this important teaching. So don't mind my sweat, okay? Just pay the attention. So, but one thing I would like, whenever I am teaching, I would like people to ask me questions. You know, I'm a health consultant. I'm a lecturer too. I'm a teacher. So after the teaching, ask me some of the questions in my comment section. I will be able to answer you. Don't just watch and go. Just ask questions. I'm here. I have my doctors too that will also help me to answer your questions. So go ahead and ask your questions. Hormones are essential for regulating most of our major body processes, like our mood swing, body temperature, metabolism, heart rate, sleep, reproductive cycles, growth, and stress. Everything that has to do with hormone, our bodily processes, our hormone is in charge of it. That is why even your reproductive organ, you cannot conceive without hormone. You cannot produce egg in your ovaries without hormone. So hormone is very, very essential for our system. Hormones in women normally fluctuate. If you don't know, it normally fluctuates at a certain time, such as before or during menstruations. You see, that's why you see some people, because of the fluctuation, it fluctuates. You see them sometimes in the month they might not be menstruating. So when your hormone starts fluctuating, they will call it hormonal imbalance. Or maybe when you are not seeing your period, you time it hormonal imbalance. There are certain things that will happen in your body. I am going to explain to you. I'm going to tell you for you to know that you are having hormonal imbalance. Yeah. Hormone level in women normally fluctuates at certain times, such as before or during menstruation. Female hormone imbalance is common in adrenaline, steroid hormones, growth hormones, insulin, estrogen, or progesterone. This is a chemical produced by your ovary that help you to sleep. Yes, we have a hormone. Remember, we have so many hormones that control our body processes. Not only female hormone, we have every other hormone in the system. Now, what are the symptoms of hormonal imbalance? We have many symptoms of hormonal imbalance. One, once you are passing through hormonal imbalance, there are some changes that will be happening in your body for you to say, yes, I'm passing through hormone. Some people may not really know until they go for lab tests or they go and meet a gynecologist before they will know that they are having hormonal imbalance. So I'm going to talk to you, I'm going to explain to you symptoms of hormone that will help you to understand, to know that you are having hormonal imbalance. Number one is weight gain. When you start noticing that you are adding extra pounds, extra weight, you know that you are, go and check yourself. You see your body adding up. You are not pregnant, but you see yourself adding up. It's when you are pregnant that you'll be adding up. Or maybe when you have eaten something, you've taking those your trans fats and saturated food I say you should not be taking, or maybe when you are eating late at night, when I told you not to be eating late at night, that's when you notice. Those ones are different. But when you maybe you start having weight gain unnecessarily, go and check yourself. Another one is reduced interest in sex. Some people also feel dry. Reduced interest in sex. Your husband will be wanting you, but you're not feeling like having sexual urge. You don't have it. Yes, at a certain age when you are growing older, that's having interest in sex will reduce. But when you now notice it that you're no longer having that interest in sex, go and check yourself. Another one is infertility. When you are trying to conceive, you have done everything to see if you can conceive and it's not coming, the baby is not entering for many months, for many years, go and check your hormonal imbalance. Another one is mood swing. Your mood will be changing from one thing to another. Another one is vaginal dryness. A lot of women feel dryness in their vagina. Once their husband entered them, they are no longer enjoying the sex again. Some that place will be very, very dry. Some will be using lubricants and all that. So once you notice that you are passing through hormonal imbalance. Another one is hot flashes. You've been noticing hot flashes, sweating unnecessarily, and mood swing. Yes, these are symptoms, signs and symptoms of hormonal imbalance. Another one is tingling or numbness in your hands. Numbness in your hands. When you are feeling tingling and numbness in your hands is another sign of hormonal imbalance. Another one is heavy or irregular menstruations. Your menses will just be, this month it will come, next month it will not come, just like that. You are having such problem. Another one is trouble in sleeping. You are finding it difficult to sleep. When you go to bed, you find it difficult, you cannot sleep. This is another factor. The next one is change in your appetite. You may not have appetite to eat. Another one is deepening voice. Your voice will start changing. Another one is altered heart rate. Another one is soreness in your breast. Soreness in your breast. Another one is swollen face. Your face will swollen up. Another one is headache. You'll be having slight headache. Another one is enlarged clitoris. Some people, they will have enlarged clitoris. Another one is thirst. You feel like drinking water. Another one is unnecessary sweating. Another one is dry skin, bloating, and weak bones. These are the signs and symptoms of hormonal imbalance. So check yourself if you are having all these things I mentioned, and then know yourself. Now, what are the predisposing factors of hormonal imbalance? What are these predisposing factors of hormonal imbalance? What are the things that causes it? That's what I'm talking about. Number one is puberty. Another one is because there is PCOS, because it says this sign of infertility in women. A lot of women are passing through it. Another one is pregnancy. When you are pregnant, these are the predisposing factor that may cause that hormonal imbalance for you. The next one is chronic stress. A lot of us pass through. If that's my next teaching, I'll talk about stress and eat management. I'll talk about stress. If I tell you this stress we are passing every day, in the morning you saw some people will wake up around 5 p.m. They have gone to work. From work they'll be going about from their market, no rest. You see some people will go out in the morning, in the night, no rest. They will not have siesta, they will not sleep. in the night, some will be coming around 12 p.m. That FM, they will start with their computer, no rest. You are stressing your body. And or if you're a woman have limited, you don't need to be stressing yourself, especially if you want to start, if you want to be having children. Stress is very, very dangerous. It's not really good. That's why you should set a time yourself time to sleep, to have enough rest. You need it. Rest is very, very important. The next one is menopause. Once you're approaching premenopause or menopause, or you are passing through menopausal symptoms, you will have a hormonal imbalance. The next one is what we call steroids. The next one is certain medication. There are some medicines you'll be taking that will predispose you to hormonal imbalance. So let us check. There are so many other ones that I may not be able to recite, I may not be able to bring out, I may not be able to say, but there are other causes, predisposing factor to hormonal imbalance. Like I said, I have talked about certain medications. There are some medicines you take that will predispose you to hormonal imbalance. Another one is endocrine gland injury caused by radiation. Radiation also can predispose one to hormonal imbalance. Like every day we are faced with radiation from your phone, radiation from your machine, radiation. You don't know that even this phone can cause you problems. This phone we are holding can cause you problems. So these are the things that predispose us to hormonal imbalance. Another one is infection. A lot of women have infection. Untreated infection. That's whenever you notice infection in your system, run immediately to go and treat it. Infection is good, be it sexually transmitted diseases, be it pelvic inflammatory diseases, be it cervical infection, be it ovarian cysts. All these things can result in hormonal imbalance. Whenever you have infection, go and treat it immediately. That's why we emphasize on faithfulness in marriage. A lot of couples are not faithful. You are married, you are having side chick, you are having extra person outside your marriage, you are exposing yourself to all this problem. Another one is trauma. When you have trauma, when you have shock, when you are depressed, when you have all these things can predispose one to hormonal imbalance. Excessive blood loss or damage of your from excessive blood loss or damage from surgery, all those things. Tumors, when you have tumors, growth, and on your when you have growth, all these things can cause hormonal imbalance. So how will you manage this hormonal imbalance? How will you manage this hormonal imbalance? Do you know you can manage them? That's the most important thing. Now you have discovered, you have gone to run tests. For you to discover, go to and see your gynecologist, go and run tests to find out whether you have hormonal imbalance. Then when you have noticed it, what will you do? I'm talking on prevention. What will you do to prevent it? Number one is exercise. A lot of women don't do exercise. This exercise is very, very important in our daily life. Important is very, very good. You run, you exercise, you stretch your hands. Bring out time in a week, maybe 3 times in a week to exercise. Burn some fat, lose some calories, lose some body fat. Check your BMI, your body mass index. Check yourself to know your body weight. At least a woman, as long as you are conceiving, at least from 65, 70, latest 85. Try to reduce your weight to 85 and stop at that, even 80. So when you are too overweight, it can cause a lot of problems, but you don't know. Exercise is very, very essential for us. Another one is eating a diet full of whole. I've talked about balanced diet. Taking a diet full of whole grains, fruits and vegetables. I keep talking about it, eating healthy. When you are eating healthy, you are not doing it only for you for those people that have high blood sugar or those that have high blood pressure. No, it's for you, for your general health. Because when you are taking, especially natural food is good. Take a lot of fruits, take a lot of natural food. Reduce your harm from eating saturated and trans fats. Anything that has to do with all these junk food, try to reduce it. Cook your food. I'm talking about cook your food. Women, go to market, cook your food. Stop. It's not really good every time you are buying food. Cook your own natural food. Cook for your family. Women are supposed to know how to cook. Cook for your family. Cook for your husband. Cook for your family, for them to stay healthy for you. Another one, drink enough water. Water is good. Forget about all these canned drinks, whatever. Just take natural food. If you want to go for drinks, you have our tiger nuts. You can go to market and prepare. You have your zobo, you have your soya milk. Prepare those natural drinks and take it. Your fruits. I used to tell people, you can go to market, buy a lot of fruits. Buy your cucumber, buy your carrots, buy your apple, buy your watermelon. All those things. Blend them. put it in a container and be drinking. That's your juice. It's better than all this kind of drink you are taking. Another one is getting enough sleep and enough rest. I've talked about it. Another one is managing your stress level. I've talked about it. Managing your stress level. I've talked about it. Another one is quit smoking. For those of you that smoke, quit smoking. Smoking is not, it's liable to die young. So smoking. Limit your intake of alcohol. Those of you that drink, you go to a party, you go to a club, they'll be telling you, you will stay there and finish 1 carton, 2 cartons of Star. Who are you doing? You are doing yourself. Okay, you are doing it because they want them to tell you that you are rich or you can consume alcohol. You see your stomach will just big like this. Who are you? You are deceiving you. Stop drinking. Use that time of drinking to go and make money and do other things. No, stop drinking too much. You are endangering your health. Another one I've talked about drinking. Another one is take your supplements. I used to tell people, supplement is very, very good. No stem cell supplement is very, very good because you cannot get everything from food. You see, all this food is like vegetable. Before you put it in your fire, everything, all the nutrients have gone. Try and from time to time buy supplement and take. If you don't have anyone to buy, call me. Contact me, Kina. My phone number is here. I am the madam of. What name will I give myself? I am the pata oga of Odogu of supplements. Call me anytime. I will give you the one that you use to supplement yourself. Very, very good. Like I said, I recommend stem cell healthy products. Another one is take your medication prescribed to you by your doctor. Visit your gynecologist. Limit your intake of sugar. A lot of people take a lot of sugar. If you cannot eat without sugar, everything, this synthetic sugar, refined sugar, stop it. Can't you eat without sugar? Tell me, what will happen to you if you stop eating sugar? Another one, reduce weight. I've talked about this, so I have done with my teaching today on causes and management of hormonal imbalance. So listen to my talk, please share it to help a lot of people. When you are sharing my page, you are doing good to yourself and to people. When you love anyone, the highest gift you give to somebody is to give them good thing that will help them in life. Share it. Facebook help me share it to people because a lot of people are passing through hormonal changes. Wherever you are hearing me, TikTok, share it. Everybody share it. My friends in Facebook and TikTok, share it to people. Let them this message get to people. As you are doing it, you are helping to save life. You are helping that person that is passing through hormonal imbalance. Stay tuned. I will come to you today. I will still discuss the causes and management of poor and premature ejaculation. I think that will be another topic I will treat today. So stay tuned. Stay on my page. From time to time in the evening, I will still talk on the causes and management of poor or what we call premature ejaculation for men. Thank you very much. This is my channel, my Facebook channel, Kina TV. Join it, Kina TV. It will be showing in the screen. My TikTok channel, Kina Good 0. So join it. If you have not followed me in 2 of them because there I'll be teaching about health conditions requiring counseling. Share it, and then chat me up. My phone number, my WhatsApp number is there. My comment section is there. Or you can WhatsApp me on my WhatsApp number +234 8060 631555 +234 +234 8060 631555. Thank you.